and you should get a notice about that as well. So anyway, so as I mentioned, my name is Jenny Schwartz. I'm the Director of Helping here at Jewish for Good, and I mentioned my colleagues are here as well, Stacy, Shoshana, and Jordana. Thank you for joining us for this special program, which is funded in part with grants from the Carolina Foundation for Jewish Seniors and the Leon Levine Foundation. Jewish for Good's Helping Department offers a comprehensive range of services that help people meet life's challenges. We deliver high quality professional social services for adults and their families through all stages of life. This includes counseling, case management, financial assistance, food pantry, and programs like this. Much of what we offer is free, and all of it is open to everybody, Jewish or not. For more information, I invite you to visit our website at jewishforgood.org and look at some of our upcoming programs we plan, like Shmooze and Nosh, which it will be coming up on Wednesday, April 26th at 2 p.m., Care Partner Support Group, and Memory Cafe programs. And today we get the honor of kicking off this great program with a great speaker, Dr. Heather Altman. Dr. Altman has more than 20 years of experience in the nonprofit healthcare and aging services sector. She specializes in promoting community-based initiatives, addressing service delivery, workforce development, and policy and planning related to aging services and supports, with particular emphasis on supporting aging in community and caregiver resources. After 17 years leading local, state, national, and international programs on behalf of a wonderfully innovative continuing care retirement community, Dr. Altman transitioned to consulting in order to support her intensely gratifying role as a family caregiver. She consults on a range of aging and healthcare related initiatives with businesses, nonprofit organizations, academic institutions, government agencies, and private individuals. Additionally, Dr. Altman serves on the boards of nonprofits and public agencies dedicated to supporting older adults and their caregivers. She's an adjunct faculty appointment with the UNC Gilling School of Global Public Health and formerly with the UNC Keenan Flagler Business School. Dr. Altman's work with the North Carolina Serious Illness Coalition offers her the opportunity to host their twice monthly online news style show, Friday Facts, interviewing healthcare leaders and advocates from across North Carolina. She's also the host of an upcoming weekly radio program on WCOM dedicated to aging issues, sponsored by the Orange County Department on Aging. Dr. Altman received her undergraduate degree from Brandeis University and her master's and doctoral degrees in public health from UNC Gilling School of Global Public Health, She's a certified case manager and an advanced professional with the Aging Life Association. And today she's going to be talking about proactive planning and for aging and engaging. So we are very lucky to have her here today, and welcome, Dr. Altman.
Thank you. I'm so excited to be here and to see all of now it went to speaker view, so I lost some of your faces, but I have lots of friends I consider family, and so this is wonderful. Should I go back to sharing my screen so you have my slides?
That would be great. Thank you. Sorry about that. Sorry.
All right. let's do this. Share. There we go. Do you all see my slides? Yeah?
Yes.
Okay. Great. Yes, Jenny will be the spokesperson for all of you, since I know you're all muted, but she's the one that's not able to. And I see my good friend Lois Sobel, and we talked about this the other day. Many of you know me well. I am a big talker and a fast talker, and she said, don't talk too fast. So Lois, if I'm going too fast, you put a note in the chat and Jenny will say, Lois said to slow down, and that will be completely fine. I love Zoom. I love talking and sharing. What I don't love is when I share the screen, because what it does is it makes all your sweet faces really small. So I don't get to see you and your faces as much, but I'll try to click around and see. Just a quick check. Can you all hear me okay? Lois, I'm looking at you. Can you hear me okay? Do I sound okay? All right, good. So that was a really great introduction. Thank you, Jenny, and thank you for the organizers for inviting me. I want to talk a little bit about myself, and then just so you know, as my mother who passed away, where do you come off? Where do you come off sharing this? And so I want to give you just a little bit more on a more personal sense about my background, and then we're going to dive into it. I'm really excited to be here today to kick off the Aging and Thriving Conference. So just a little bit more about me so you know my passion for both of these issues, aging and thriving, and then with my own talk, proactive planning. Love aging and love talking about engaging. I'm originally from Boston, and you heard I went to Brandeis undergrad. I'm from Boston, grew up there, but I moved down to Chapel Hill in 1997 to attend UNC Gilling School of Global Public Health. And over the years, both my master's and doctoral degrees are in public health. A lot of people think it's social work, but it's actually public health with a focus on health behavior and health policy. While I was at Carolina in 1998, I met the CEO of Carol Woods Retirement Community, and I fell in love. I fell in love both with the continuing care retirement community concept and with the CEO, Pat Sprigg. And so after graduating and working for a few years in Washington, D.C., I actually moved back to Chapel Hill and joined the Carol Woods staff, where I stayed for 17 years. Mostly focusing on community initiatives, including statewide initiatives and national programs to support older adults and caregivers. But I also helped, for the purposes of this discussion, I helped to launch and run our early acceptance program, where I worked with more than 150 individuals and couples who live in their own homes in the community here in the Chapel Hill, Durham area, helping them navigate choices in their home and when to consider moving. And so I've spent quite a bit of time with folks kind of talking about the issues we're going to talk about today. As Jenny alluded to in July, and some of you know, in July of 2019, my universe blew up when my father, somewhat overnight, became critically ill following outpatient surgery. And I rushed back to Boston and stayed there for most of the next 5 months as he and my family learned how to navigate the complexity of ICU care and long-term acute care. Miraculously, he got better, and he was just at the JCC yesterday, and many of you may know my dad, Stuart Altman. He's fantastic, and wonderfully as he got better, but it was clear my mother was starting her decline. So I left Carol Woods in January 2020 to assist both my parents to move down to Chapel Hill permanently. They did have a place where they came down seasonally, and I started my journey as a full-time caregiver. And then all of us, our collective worlds blew up in March of 2020 with the pandemic. And while I was a bit guilty for no longer being on the front lines of residential long-term care, I joined the front lines of 53 million other caregivers managing their loved ones at home. And during the height of the pandemic, I was able to turn my parents' apartment from independent living to our own assisted living, and then skilled nursing, and then hospice. And my mother passed away in November 2020. So as Jenny said, I now run my own consulting business. It allows me to have the flexibility to still be there for my family. And I work with organizations on their aging and healthcare related projects, including serving as the deputy director of the North Carolina Serious Illness Coalition. And I do work with a small group of private clients as an aging life care professional. That's the term formerly known as geriatric care managers, offering support and resource consultations. So I say all that because I come to you both with my professional experience in the aging space, but also with my personal experiences as a daughter and as a caregiver, and now as a woman in her 50s, planning for my own aging needs with my husband and my daughters. So let's get to it. And I will say you will have all, I've already sent to Jenny, you have copies of these slides. And so have my email address there if you want to connect with me. All right, so let's get started. It's kind of a busy slide, but when I was younger, during my family's frequent trips out for Chinese food, I loved ordering poo-poo platters. That's that picture. Do people, any other poo-poo platter lovers there? I just loved it. They were fun platters with lots of different appetizers to try. You didn't have to pick just one. Nowadays, you see the other picture, charcuterie platters are all the rage. Same concept, lots of bite-sized pieces of different things. And that's really what this talk is going to be. Lots of bite-sized pieces of information. This is truly what could be 10 separate talks smushed into one. So it's going to be a quick, high-level overview to touch on a range of issues for you to consider as you think about your own planning. I know, and I even saw some of you gave questions beforehand, each of you have your own unique needs and goals. And so I say seriously and heartfeltly apologies in advance if you are things that you want more information about. And I'm going to try to include resources throughout for you to dive deeper. And honestly, as I think about it, if this keeps you wanting more, and I hope it does, then I'll consider it a success. I just want this to be one moment in a journey of planning for aging and engaging. My goal this morning is just to open your minds up to a range of issues that you may or may not have considered before. So looking at this list, let's see, we're going to talk about staying engaged and socially active. We're going to talk about preparing key documents, a little bit about advanced care planning, talk about aging in place, housing, safety and technology, transportation, health and long-term care options, paying for care, preparing for caregiving. So, phew, that's a lot. And these slides may look busy, but I did want you to have the bulk of the information available. So you'll be able to look at the slides afterwards to remind you of what we discussed. So really don't worry about reading it all. I'll go over all the information. And so just plan to sit back, listen, and think of questions, and you can put them in chat, or at the end, we can jump into them together. I do want to also say I'm honored to be kicking off the Aging and Thriving Conference. Given the other exciting speakers this week, I'm not going to dive into things that they're going to touch on. So issues around nutrition and physical and brain health issues. I really encourage you to listen in on Wednesday and Thursday when those topics are discussed. And I'm only briefly going to dive into what is my passion area a lot lately with my work with the Serious Illness Coalition, and that's advanced care planning. Because tomorrow's presentation looks really fantastic on planning for difficult conversations. So my gratitude to the organizers for putting together what looks like a really exciting conference, and I'm honored to be a part of it. So
I just want to interrupt really quickly. We are getting some feedback that at points, I think when your head's down, your voice is going in and out a little bit. So just
how's that? Is that a little better?
That's better for me. And I'll let you know if it changes for people on the chat. Thank you.
Okay. Oh yeah, that's right. The chat is not open. Okay. All right. Is that a little bit better? I can also talk a little louder.
It's better for me. I think it sounds good when I think it only happened when you were looking down. So I think we're good.
Okay. Well, I'll look down at my notes, but I'll try to hold my notes up a little bit higher then. How's that?
Thank you.
And you tell me how that is. Also, I don't want to block the speakers. I want to get started with why proactive planning for aging and engaging. Why do we plan? I think what we hear most often is that people want to have a sense of peace of mind to help us be prepared for managing the known and the unknown. Because let's face it, the pandemic, we're coming through years of the unknown. And for many of us, and like me, you suddenly get thrown into situations that you did not expect to be thrown into. So really, you're planning to expect the unexpected, which is incredibly hard to do. So the key is figuring out where to prepare and where to simply stay flexible. And no question, when it comes to planning, what I often hear, and I've been hearing this for more than 20 years, is I don't want to be a burden. And that is different for different people. I don't want to be a burden to my spouse. I don't want to be a burden to my children, to my family, to my friends, to my neighbors. And so burden can mean a lot of different things to a lot of people. So I invite you, if not now, then later on, to do some soul searching about what planning would be helpful, what planning do you expect and hope to be provided and given to yourself? What do you expect to come from other people on a range of issues? I'm very used to talking with people who give me blank stares, so I'll see if I'm getting any blank stares when we first discuss these issues. And then I get later comments of, well, that really got us talking about it over dinner. And so, I want you to think about what would give you peace of mind. And remember, it's very different for each of you. And so that's why we're going to go into this process together. Now, we're going to start with what I think is the fun things, which is the power of being socially active, engaged. And I say this honestly, you all get a gold star for participating today on a number of different levels. We're going to talk about the health benefits in the broadest sense of the word, especially when it comes to staying socially engaged. But think about what it took for you to participate today. And you may think, oh, that's no big deal. But you got the emails or you saw the posters, you signed up, you showed up, you got your Zooms working. And seriously, those are the key building blocks for staying engaged, and especially in this world when so many options are online. So I did want to give you a little gold star for that. But let's talk really quickly about the benefits of social connections. Studies continue to show that social connections can help reduce the risk of depression, anxiety, cognitive decline, physical ailments such as heart disease and stroke. Social connections can also improve our mood, boost our self-esteem, and provide a sense of purpose and belonging. Now, I'm a really positive person. I'd love to just stop there about the benefits, but I know some of you and I know this community, and some people get motivated by risks instead. So I'm going to talk briefly that research consistently shows that lack of social connections heightens our health risks as much as smoking 15 cigarettes a day or having alcohol use disorder. Loneliness and isolation are twice as harmful to physical and mental health as obesity. So I throw that out there if you're motivated either by the positives or the risks. So back to the positive, how you can stay socially active and engaged, and some options include volunteering in the community. This is really a great way to meet new people, give back to the community, and studies consistently show the power of volunteering and helping others as a way to truly help ourselves. You could join a social club or group. This could be a book club, a gardening club, a fitness class, finding something that interests you and finding a way to join like-minded individuals. Okay, good. I'm just taking a peek at the chat box to make sure we're still doing okay as we're being socially engaged. And then taking classes or workshops like this one. Jewish for Good, I am a member and I see there is so much going on at Jewish for Good, so joining those programs. I'll give you links to the senior centers. I know many of you live in either Orange County or Durham County, and I've linked to those senior centers. Wonderful programs. There's programs like OLLI and other programs for lifelong learning, so really great ways to stay engaged. There's wonderful community events in our area throughout the Triangle. There are concerts and festivals and farmers markets. I spent this weekend going to a wonderful show at Playmakers. So there's fantastic ways to get involved, attend these events, but don't just go, strike up a conversation, talk with other people, meet someone new. And lastly, connect with family and friends. I think clearly people love doing that in person, but what we've learned more than anything during the pandemic is there's lots we can do over the phone and through videos. It's important that we find activities that are enjoyable and meaningful and really make an effort to stay engaged with others. And I think, well, again, the fact that you're here, I'm preaching to the choir, which is kind of a funny term to give to all of you, but you're here. And I do think it is easy for folks to find barriers to staying engaged. And we know the pandemic heightened so many challenges to bring us together. And that said, it also expanded our creativity. One bright spot was the massive growth in comfort with online gatherings, such as this event through Zoom and other platforms. Some of you may, if you're not already comfortable, there's Microsoft Teams, there's Facebook events. And as I shared, and many of you knew her, my mother died during the height of the pandemic, and we had the most beautiful Zoom Shiva with more family and friends participating from across the country than I think if we held it in person. So really finding new and lovely ways to stay connected. I do want to touch on the barriers, because if people say, well, what about? If you have them now or in the future, Things like mobility issues, transportation difficulties, health issues, lack of confidence or social anxiety. To overcome these barriers, you can explore activities and events that are accessible and accommodate mobility needs. There is a lot of community-based transportation services and ride-sharing services. We have free and low-cost options throughout the community. And if you don't know how to use Uber or Lyft, I highly encourage you. Just got back from New York, where I Ubered around and Uber around the community here sometimes. So they really do open up a range of transportation options that really, as I helped folks with transportation issues 10 years ago, we have a lot more now. Connect with others. For those of you with health concerns, find your group, find others that share the same health concerns. And I'll talk a little bit about that with support groups. You can practice your social skills and build confidence through small interactions and gradually work up to larger ones. And so I think it's really important as we close out this to make social engagement a priority in our lives, being open to try new things, staying connected with family and friends, joining activities that align with our interests. And then, of course, and there'll be a lot more about this later on in the week, really taking care of your physical and mental health, which can improve your social connections and engagement. It doesn't have to be complicated or expensive. It's often the simple things, striking up a conversation with the neighbor. I know I hang out at my dad's complex. We sit on the bench and start chatting with people. My old neighborhood, I would just go and get the mail and neighbors would come out. So these really do such an impact on our social well-being and our healthcare. So there's our push on engagement. Now, going on to proactive planning. This is what people generally think about when you start thinking about preparing for aging. And so usually they talk about the forms, the documents, but it's really beyond the forms. It's highlighting your wishes and finding ways to make sure that your wishes are shared and known and documented. We know that all of us are going to pass away at some point, but many people don't realize it's also common for most of us in some ways, to lose capacity to manage certain types on this slide of financial or legal issues. It could be super short term because of a short-term illness or surgery or accident, or it could be longer term. So really anyone over the age of 18 should have most or all of these at the ready. And I recently was in Colorado visiting my 21-year-old daughter at college, and I said, it's time. And we filled out almost all of these documents for her. So I hate to say this, but we had a great presentation by Diane Meyer, who's just an expert and nationally known speaker on advanced care planning. And she said, look, any of us can be hit by a truck. And so if you're over the age of 18, you really need to have key documents. Just about a week ago, I was in a lovely presentation with two of our local estate care attorneys, and they, which was very classy. They were from different firms, and it was very collective, and they shared information, and they highlighted the 5 key documents you should have. There's going to be probably more documents for some of you, but I'm going to go through the non-healthcare ones on this slide. You really want to have a will. You want to decide who gets what and make sure those issues and are known and documented. You don't want the state of North Carolina having to make those decisions for you. So that's key. And some will have more complicated wills than other, but the will is up there. And then the second thing is you need to designate a person, and ideally a backup person, to manage your affairs and your finances and legal issues if you're not able to do that yourself. So again, and we had this, my dad had surgery and was in the ICU and on a ventilator for months. And so we needed to sort of, we were glad we had these things. So again, it's very important that you get these documents in place. There's lots of resources online. I just did a quick Google search. Those are the fun pictures. There's all kinds of fun checklists. I am going to give you some at the end and during it. And also, this is maybe touched on during tomorrow's talk about difficult conversations. Clearly, I get no kickback from attorneys, but for many of you, it might be really helpful to work with an attorney, especially if you have more complicated issues and you start to get into issues of trust and other parts of estate planning. But you can also get these things online and do them yourself. So the key is that you have them. And the key is that you have them and people know where to find them. Do not put these in your safe deposit box because your loved ones can't find it. So, and then I put little questions at the end or in the middle for you to think about things like, do you need trust? If you have life insurance, do you have your beneficiaries named on either your life insurance, or you might have 401ks or other work? We had this experience in my own family. I see others. People may have multiple accounts. Make sure you have your beneficiaries named, because you don't want to have to go. You don't want to have to go into probate because the account that you opened 40 years ago that you never named, or it gets sort of interesting if you named potentially an ex-spouse or someone who's not with us anymore. So again, really be thinking about beneficiaries. As for your durable power of attorney or your loved ones, who are your attorneys? Who are your financial planners? So people know who to talk to. Where are these things kept? Okay, they're kept in the file. My husband manages a lot of it. And I'm like, where's the files? So I know which drawer has the files. My dad has a black binder. Where are things kept? And so you know. Again, your bank accounts. Some people have one bank account. Some people have many. So just where are these things available? And lastly, and this gets kind of interesting, the who gets what. You may want to start doing lists, and these might not be things, in your will. People think about their house or their cars or their money, but what about your furniture or your artwork or, other jewelry is a big thing. So making lists, even handwritten lists, so families know, it's very nice. We're going to talk about decluttering soon, but you may have collections. Let your loved ones know, or have it be a family discussion, especially if it's around downsizing. I just talked to a colleague recently who said the family had such a wonderful time after their grandmother passed away, going through things, and it was such a joyous moment. They were sad she wasn't a part of it. So you can either give it away now, as my mother said, come and take your crap out of here, or you can just say, hey, I want it to be aware that this should go there, this should go there. And then a quick story after when my parents moved here permanently, out of all their lovely things, what was the thing that 7 of us wanted? Was this cool little rainbow pillow they got in like Berkeley in the 60s. And that was the item that had the most people want. It wasn't the expensive items, or Dad's like, nobody wants my expensive dining room set. No, people wanted the cool rainbow pillow. And I pulled seniority and I got it. So, but it is funny, having these conversations. And if you think it might be a little contentious, start to put some names on it. All right, so this is super quick, I know, I'm sorry, but this is just to give you a little poo-poo platter taste of the key documents for non-health. So let's go to healthcare. I'm going again, this is going to be, I think, a big focus of tomorrow's discussion on difficult conversations. So advanced care planning talks about making decisions about our healthcare preferences in the event that we are unable to make these decisions for ourselves. This can include decisions about life-sustaining treatments, end-of-life care, afterwards for funeral arrangements. But the key thing is that it really specifies who can talk for you if you cannot talk for yourself, and who has access to our healthcare documents. Again, going back to the known and the unknown, sometimes it's hard, and I just refilled out these forms last week. It is hard, hypothetically, to make these decisions in advance, but you want to at least put your general preferences out there, and that's what your advance directive, including a living will help you do. The most important thing is that you have a healthcare proxy and you have a backup for your healthcare proxy. It may be that your spouse is your healthcare proxy, but if something happens to both of you, then maybe like in my family, it goes to children, or it might go to your best friend, or it might go to neighbors, it might go to someone else. But again, really putting that out there. Many of us have HIPAA documents. Those are those your protected healthcare information documents. We often fill them out at the doctor's office. We're usually in such a rush, we maybe just put one name, like our spouse's name or our children's name or your best friend's name. But you can have, and I have this, general HIPAA documents that put the range of people, so that way, and we had it here. My best friend was got a traumatic brain injury from a bike accident. And the first people to get on the scene into the hospital was me and other friends. And so with my HIPAA documents, I do have, since my family often lives away, I have people here that I care about, that I trust, and I have their names on HIPAA. So that way they can have access to my healthcare information. Can't make healthcare decisions, but they can have access to information to be able to share. A quick comment about advanced directives and living will. If issues, some of you may have advanced diseases now, or you may have it in the future. If you're starting to experience a serious illness or advanced diseases, you may talk with your physician about filling out things like the MOST form. Those are medical orders for scope of treatment. These are literal orders that outline your preferences for the kinds of treatments you want. That DNRs, do not resuscitate, do not hospitalize. Those are the things that as it moves from the hypothetical to the actual, it's a good time to update the forms and really get more in. I'm going to stop there because, again, there's so many great resources out there. Tomorrow, they're going to talk about the Conversation Project. I did want to give you the link to the North Carolina Serious Illness Coalition, where I work. We have a whole section with lots of videos, and you can download the Secretary of Health of Secretary of State, North Carolina documents. So that way you can have a way, after you discuss your wishes with your loved ones and your healthcare providers, you can go ahead and get that documented. All right, I'm going to do a quick check-in, make sure everyone can hear me okay. I don't see any that's, but then again, okay, thank you, Debbie, for the thumbs up, because I can see you. You're the best. Now we're moving from documents to aging in place. This is that popular term, aging in place. There's a part of me that is a bit of a social services and social sciences researcher, and I hate the question. It's a crazy research question to ask people, where do you want to live? Anytime AARP does this, 90% of the people say they want to age in place. So it's like a throwaway question now. Most people say they want to age in place. But what does that really mean? Let's talk about it. So as a definition, aging in place is defined as the ability to remain in one's own home or community in spite of changes in health and functioning in later life. That said, there was a focus for a number of years ago on really changing that to aging in community, or even refocusing, what does home mean? Home is wherever you are, and that is wherever. What people generally want is often a sense of attachment or connections, feelings of security and familiarity in relation to both your home and community. So now for many people, they really want to stay in their actual home. I hear it all the time. They want to stay in the home they've been in for 40 years. And so I say lovingly and somewhat jokingly, you love your home, but does your home love you? Will it really allow you to stay despite changes to your health and function? And if so, fantastic. And we're going to dive into this in a second, but I do want to take a moment to acknowledge that for many people, whether their home can truly support them or not, because of finances, it's where they have to stay. They really don't have this issue. But let's dive deeper into housing. Oh, before we dive deeper into housing, it's my favorite slide, so I don't know why I almost, this is just, there's a lot here, but what I want to tell you about is when we're thinking about aging in place and aging in community, a lot of people think simply about their home. They want to stay in their house, but there has been a growing effort over the past, really it's close to 20 years, but over the past 10 years to really look at how age-friendly and livable your entire community is. These are frameworks, and I referenced through the World Health Organization, and AARP is the US chapter of the World Health Organization that's really promoting age-friendly communities. And so I just want to briefly share this. This is actually what my doctoral dissertation was about. So I could just spend this entire time talking about age-friendly community, but this is the quick poo-poo platter version. When you think about aging in place, the issues that you want to think about, and some of the things we're going to dive into more, what's the community you're in, what healthcare is provided, what are the transportation issues, what are the different housing options, do you have options for social participation, what are the outdoor spaces and buildings, are they accessible, can you enjoy them, is there respect and social inclusion, especially for older adults? Do you have the opportunity for civic participation and employment? And are there ways for communication and information to be shared? So aging in place, the big picture here is to think beyond simply your home, but the fullness of your community. But let's go home. Let's talk about housing considerations. As we're all aging and we all need to consider our housing needs and whether our current living situation will be sustainable as we get older. So some questions to ask ourselves. This is part of your soul searching, later on lunch or dinner conversations with yourselves or the people in your life. Is your home easily accessible and navigable? Where is the bathroom in the bedroom? That's where I always, when I go into places, I like to look at it. Is it upstairs? Can you get to them easily? If you started to need assistance or just that hip surgery or knee surgery or stairs get more complicated, are you able to get easily to bedroom and bathroom? That's generally what I like to look at. Is your home close, and we're going to dive into other things, is your home close to essential services? Kind of like what we talked about on the slide. Are you near healthcare? Are you near grocery stores? And then the big question, would downsizing to a smaller space be a better option? Maybe, maybe not now, but maybe in the future. And it's just sort of thinking about that. And then another question, and I didn't add it here, but I talked with folks about it all the time. Or are you sick of maintaining your home? Some folks are in large places. I saw a wave from you, Debbie. You're the picture I see. So you're my person. I saw you. Are you sick of maintaining the home, the roof, the dishwasher? But also, are there issues? Many folks, not me, many folks love their garden. They love their landscape. They love their properties. They love their big driveways that get iced in. So it just becomes a question, are you sick of maintaining your home? On the flip side, do you love maintaining your home? Does it give you a sense of joy and engagement? So this is not to have you think bad about your home. I want you to continue to love it, but it's just things to think about. Again, this is all about proactive planning. If you were to start to think about needing assistive devices or modifications to your home, would that help make your home more accessible and allow you to stay there longer? Things like grab bars or ramps to the entrance of the home. Much to my parents in their home in Boston installed a stair climber. And my mother loved it. And I shook my head, but she really felt it gave her a few more years in that home. And it wasn't us encouraging her to do it. It's the fire department when they came to visit and said, this is no longer a safe stairwell for you to get up and down. And she was like, all right, I'll get it. And my dad get it. And it was truly fun, but those are expensive. So again, you start to think about, where do you want to be? Other things to think about with your, it's like I got a very generous mouse here. So this is also housing, but it's safety considerations in your house. Things that others, if you have professionals come into your home, these are things they're going to look at. So you can start looking at yourself. Do you have tripping hazards? I do. My dad does. We love our lovely rugs, but is there a time when the rugs become tripping hazards? Decluttering, that becomes a huge issue. And I'll do a quick, I wasn't sure where I was going to do it, so I'll do it now. I cannot tell you how many homes and individuals I spoke with. And the big issue with moving was downsizing and decluttering. What am I going to do with all the stuff? The idea of packing up this house that I've been in for 40 years is stressing me out. And so I will just say, get kickbacks from any of them. In our community, we have a lot of folks that help with downsizing, and even if you're not going to move, but you just want to package up things, get them ready to donate, give them to family members, or just have them be more organized. Try not to be held back by decluttering. You can do all kinds of help behavior. Okay, 5 minutes a day or 15 minutes a day or one room. But this is by and large the biggest thing that I hear from folks. And during the pandemic, when my parents were here and we moved them from their house in Boston, we did hire an amazing downsizer who went through it all and packed it up. Because this is Jewish for Good, I will say I was working with a couple many years ago, and they had lots of Judaica. And they were all prepared to donate it to Jewish for Good or Jewish Family Services. And as a way to motivate their family, they told their family, and they said, none of you are taking this, we're going to donate it. Because, and then all of a sudden the family kicked into gear. The kids, the grandkids were like, no, we want the Seder plate. We want the menorahs. So I'm not saying you should threaten your family, but I'm just saying if there are things that you know need to move on, it is time you could share it with the family and say, look, I've got a place to donate it. So if you're not going to take it, and that was funny how it really motivated them. Things like installing handrails and grab bars throughout the home. And these can be really creatively done and artistically done. And so especially in places like bathrooms, and if you're building new construction, making sure that there's the safety things behind the walls to add. But grab bars, don't use your towel rack if it's just a towel rack. Put a grab bar down and then put the towel on it, because you do see people get injured thinking that things are safer. A good friend's mother got hurt by pulling down on the shower curtain. So really look at your bathroom space, especially, and other places that, especially, and stairs and handrails. Night lights and sensor lights are huge. Just heard a research study that they did right across the street. My office is right across from Shep Center, that just doing a little bit of night lights around the doorway. We're not saying brighten your whole house when you're trying to sleep, but just enough that people can get a sense of doorways, stopped a tremendous amount of falls in assisted living organizations. So really looking at, and I have this, we have sensor lights in our bathroom for the getting up in the middle of the night. So either little lights, I've had physical therapists come and look at spaces, and they were like, do your pathway at night and make sure there are little night lights. And you can get these for just a few dollars. Installing smoke detectors and carbon monoxide detectors, keeping them up to date. And then lastly in this, keeping your emergency phone numbers visible. Where are they? Are they on, for these would be for loved ones. I wouldn't expect EMS to get them. They're usually special things, but tell your family members, are they on the refrigerator? Are they on your office desk? So again, I'm going to put a link at the end. There is to a larger discussion about keeping your home safe. It's from AARP. And something you may want to consider, especially for those of you who live in Orange County. The Orange County Department on Aging offers free home assessments by their Orange County Department on Aging staff members. So occupational therapists can come into your home and do a free home safety assessment for you and just get a series of recommendations. You also may have an OT visit that will be covered after a health. If you have some sort of health situation, knee surgery, hip surgery, any other, and they offer to write a script for a OT to come to your house, accept it, let them come. Let them look at the how high is your toilet seat? How high are, with some grab bars? These are wonderful resources. And then there's also private consultants who will do this. Again, lots of free resources online. Okay. Oh, it says no sound. Can you all hear me okay? All right, I got the thumbs up from Debbie.
We can hear you. Pointy just cuts in and out. So I'm wondering, what I may do is just put on the closed captioning and see if that can help a little bit.
Okay. Yeah, I wonder what that is. I don't know where my microphone is. I'll try to come even closer. How's that? Okay. I do want to talk really briefly about, now I have the chat on, so I want to close. Oh, I'm sorry, the sound is not great. That makes me sad. Okay. I'm closing out the chat so I can hear. How is this? Debbie, is this clearer? Okay, I'll try not to look down too much. I do want to, there's a lot of talk about the role that technology can play, especially when it comes to aging in place. This is a busy slide, but I do like that it breaks out this huge matzo ball of aging and technology options into 4 key ways that people are using them, just for you to think about. A lot of people think that that kind of bluish puzzle about communication and engagement, you know, email, chat, that we use technology to stay connected through different mechanisms. When you go to the right, home safety and security. In my world, a lot of talk about security system. PERS stand for personal emergency response systems. Those might be those little pendants you're wearing that help I've fallen and I can't get up, which literally is what people are saying. So let's not mock that. They have fallen and they can't get up and they need help. So, you know, those, and they're getting really, this is not one of them, but there's some nice jewelry ones now. So webcams, fall detection, activity monitors, lots of technology that can support that. Down below, health and wellness. I'm a huge fan of telehealth. This is how you stay connected to your providers. There may also be things around medication management or disease management. And then what we're doing right now, learning and contribution, ways of using technology to stay connected in a variety of ways. So I wanted to put a plug. There's a great website. It's really busy, but a great website, Aging and Health Technology Watch, where you can really understand, and it does dive into the specific products for each of these. Let's switch gears, literally and figuratively. That is a pun, because we're going to talk about driving really quickly. And I'm going to look at the chat. Okay, great. So yes, my pun of switching gears, driving and transportation. This is one of the most emotion-ridden issues among individuals, among their families. And that's this whole issue of when to consider not driving or less driving. It's important. Independence is important. But we do need to realize that as we're aging, there may be some signs that we may want to start driving less or stop driving. Things around difficulty seeing or hearing, slow reaction time, trouble concentrating or following directions, getting lost or disoriented while driving, frequent near misses or accidents, and the big telltale sign that starts to kick in first, which is scrapes on the car. How did that get there? And then our turns getting harder, parking getting harder. You know, that's a big issue. And I know I picked an older car, but just the other day, I did see an old yellow Volkswagen Beetle. So I saw that on the road. So I was like, ooh, that's a punch buggy. I know this is emotion laden, but it's important to be honest with yourself. If you're starting to hear comments from your family members after the initial being pissed off with them for saying something, maybe it is some time to do some reflection. And let's dive into that a little bit more. So some tips for staying safe on the road. You do want to schedule regular vision and hearing tests. May want to start limiting driving. It doesn't mean you stop driving. It just says, and I have a family member with poor eyesight, where it gets really complicated at night. So he only drives during the day and just in his hometown. This is not my dad, this is someone else. So my dad's great. Limit driving. So you may want to think about night or in bad weather conditions. Avoid distractions, cell phone. I find the GPS has become like a huge distraction now. And then consider alternatives, bus, ride sharing, Uber. If you're not sure, I really encourage everyone. We have an amazing Duke driving assessment program. I did this with my mom. There's the link to it. It's rather than getting the DMV involved in a much more sort of hardcore way, go ahead and your physician needs to do a referral. There is a private cost for it. I think it was about $200 when I did it. And it's a really comprehensive battery of tests that go through physically, cognitively, all kinds of reaction time. And it really does help answer the question for you and for your family about how safe you may be, and these are OTs, some really good suggestions to stay safe while driving. So you can continue driving, but they can give some suggestions on how to do it safer, get in and out of the car. There's all kinds of cool tools. So that's our driving talk. Now, okay, and I want to I still have a bit to go, but I want to be able to open it for questions soon. I'm going to go through this relatively quickly, just so that you understand the names of these. These are things you probably heard the names of, but just to make sure as you start to plan for options for care, either short-term care or long-term care in your homes or potentially in alternative residential communities. While we do hope to stay independent as we age, many of us are going to start to have impacts as we get older or after a health situation with what's called activities of daily living, or ADLs. These are things like bathing, dressing, eating, transferring, such as from a bed to a wheelchair. So where we need to have someone assist us. We also hear more and more about issues around companion care. This can become key with individuals as they're experiencing brain change, different types of dementia. They would benefit from someone being with them. So some options to consider in your home. This is home care. You can bring in home care aides. These can be personal care assistants, certified nursing assistants that can help with these activities of daily living. Also some light housekeeping, meal prep, other things like that. We have a lot of home care providers in this community. This is generally private pay. Many have 4-hour minimums or 12-hour minimums, but this is going to continue to be a growing field. And as I talk with folks, this is mostly all of these issues are what people want to really understand. But a lot of folks who want to remain at home are very curious about the options of bringing in some assistance to help them at their home. Home health comes in when those are usually through a prescription after a hospitalization or a health situation. That's when you're bringing nurses in, physical therapists, occupational therapists. And so while home health can often be covered by your insurance, your Medicare, Medicaid, home care itself, the first one is often private pay. Adult day programs are the gem, the unknown gem or hidden gem of helping people to stay at home who need more engagement and activities during the day. Many times these are individuals with brain changes and cognitive changes. There are wonderful adult day programs in the community. I'm absolutely thrilled Jewish for Good is going to be creating one. So these are programs that individuals give meaningful activities during the day, which allows that. It also allows their caregivers a wonderful place for their loved ones to be during the day, and they all come back together at night. Now, when you're starting to look into, if any of you are interested in alternative residential communities or different places to live, this is when we're going to start talking about independent living complexes. We have a bunch of them. They may be called active living, 55 plus communities. These are apartments or cottages where you go. Maybe there's some shared amenities like transportation or a dining room or some social activities. But the assumption is you're pretty independent, but it may have some of the benefits of you don't have to maintain the roof, you don't have to maintain the garden. There's more accessibility of the space, so there's that. When folks need 24 hours of assistance in some way, or I don't like the word supervision, but some sort of 24-hour care, that's when we get into assisted living. That's when there'll be meals involved, maybe some medication management, some help with activities of daily living. Assisted livings really range in terms of what they provide. So you've seen one assisted living, you've seen one assisted living. So you really have to dive into what are they offering. And the cost can range anywhere from $3,000 a month to $10,000 a month, depending on the services included. A number of assisted living communities do have specialized services. I have mixed feelings about memory care units, but they do have memory care environments where they can assist your loved one or yourself if they're starting to be memory issues. Mostly assisted living is private pay. And so it's not skilled. So you're looking at private pay or perhaps if you have long-term care insurance. So that becomes interesting. Going on to skilled nursing facility, I hate the facility. It adds such negative imagery. This is the nursing home, but these are licensed facilities. These are licensed residential communities that when you or your loved one needs 24 hours of skilled care, people can go to skilled nursing care for either short term after that hip replacement, or some of these might be called rehab. You need some rehab following a hospitalization, or you may need it permanently. Sometimes the term convalescent care. Skilled nursing facilities provide all kinds of, there's 24 hours of nursing and medication management and meals and activities, and is often for a short term, it may be paid for depending on whether you had a hospitalization and your healthcare needs. So this is where your health insurance, your Medicare Advantage may kick in, Medicaid. I will say, and let me go to hospice. Hospice folks may be familiar with another way underused gem. So helpful as folks are start to have a terminal illness when end of life is sort of in the future. They generally use a 6 month or under, but really amazing at providing a full range of services. We have a number of hospice communities in our area, or hospice providers, UNC, Duke, Transitions. Hospice can be provided in your home, and they also have inpatient units, or inpatient or hospice homes where you can go. And again, a wonderful resource. And I put continuing care retirement communities at the end. That's simply because it is a merge of the last four. Generally, it's one campus that has independent living, assisted living, skilled nursing, and hospice all on one campus. These communities, generally you move in at the independent living level, and sometimes almost exclusively, the higher levels are only for their own residents. Some do provide, you can do short-term stays at their higher levels, it depends. These are your Carroll Woods, your Carolina Meadows, your Forest at Duke, Cedars, Galloway Ridge, Crowsdale. I grew up professionally at one of these. I'm a fan of them, but as folks know, these can be quite expensive. And there's quite a long wait for these. In our community can be anywhere from 3, but much closer to 15-year wait. So I do say, and I'm not on staff with any of them anymore, if you are interested in this model, do not wait to get on a waiting list. These waiting lists are, can go for a really, really long time. And there's no commitment to be on the waiting list. People often mistake that and say, oh, I'm not ready to get on the list. What they're saying is I'm not ready to move in, but I got on the list at one of them when I was 45. You can get on the list at any time, especially when you start looking at that 15-year wait, especially couples who might want the 2 bedrooms that are the more popular ones. You can get on the list now. The big decision is when you actually move in, but don't wait. It pains me when people wait too long if they know this is an option for them. What is becoming common in our area, and we do have a number of them because of the long wait and the licensure issues, is or our independent living plus assisted living. So Bartlett Reserve, we have Briar Point. So these kind of focus on independent living, but they do have assisted living so you can stay on the same campus. These do not have the kind of wait times, and so I think is becoming a much more attractive option for folks. While it doesn't have skilled nursing on it, they do allow a lot of home care that can be brought in. So the hope is that people can stay there for quite a long time if they just bring additional home care in. I'm going to stop there. It's important to research these options. This is what a lot of people are curious about. Research these options, but also research your Medicare Advantage plans if you have them. Who has contracts with these places, especially when it comes to skilled nursing? You may have your favorite nursing home, but your Medicare Advantage plan. So you really want to get to know. And you don't need to be alone in this journey. Some people asked before, how can they get help? There are a variety of folks that can help. We have some great senior housing specialists, many at no cost, who can help you find the right places. So, okay, almost done because I know I want to stop soon to get to questions. Let's just do this super quickly because this is painful. Let's just rip the Band-Aid off. How do we pay for this? This is all expensive. Most of this is paid, unfortunately, for many of us through our personal savings and assets. And that's what scares the cabooses out of all of us. And this is where I can't tell you what to do. I know some of you ask questions. This is where your financial advisors, if you have lawyers, if you have accountants, or just your own sitting down and really looking at your finances and getting a sense of what things cost and how you want to plan. And it is so hard to plan for the unexpected. Some of you have long-term care insurance. That's lovely. Make sure you understand your long-term care insurance policy. So many folks, they buy it or they get it through work, but they don't really know what it covers. Find out now or tomorrow when you're bored or feeling guilty. Find out, what does your long-term care insurance cover? What kind of services? Does it cover services in the home, or is it only for nursing home care? Does it cover assisted living? And what are the amounts? And most importantly, what are the exclusion / eligibility criteria? Where do you have to be in your healthcare needs to actually receive the long-term care insurance? And also, when does it kick in? A lot have 30, 60, 90-day waiting periods. And so you want to know that, so if you have an issue, you can immediately get it started. And so get to know your long-term care insurance policy. Medicare, lots of folks have Medicare. A lot of folks do not realize Medicare is not going to be your long-term care payment provider long-term. It is surprisingly limited. There are great benefits, but it's generally after a qualified hospital stay and for a certain amount of time. And so from a rehab and recovery perspective, Medicare, your Medicare Part A can be wonderful. But if you need it long-term, that's when it gets a little bit more complicated and you're looking into private pay. Medicaid is the vast payer for long-term services and supports, but as you may be aware, there are income and asset requirements. And then there are veterans benefits that you or your spouse may be eligible. There's a great amount of information through the North Carolina Medicare and Senior Health Insurance Information Program called SHIP. There's the website. You can just type in NC SHIP and all kinds of great information, including deciding Medicare versus Medicare Advantage. And then a last hug to my fellow caregivers. Caregiving is an incredibly intense and beautiful and gratifying and stressful experience. The first thing is recognizing you're a caregiver. This is providing a loved one or a friend care for limitations they may have due to illness or injury or disability. You could be an in-person caregiver, or you can be a remote long-distance caregiver. And it's important to learn how to support yourself and your loved one, creating a support system. We have lots of great support systems and support groups in our area. This is where I really encourage you to maximize the local resources, many of them at low cost. We have our senior centers, and I'm about to link to it for Orange and Durham, Jewish for Good, and I can see now Jordana's face. There's so many wonderful support programs offered for caregivers. Lots of caregiving resources out there. There's caregiving, even online groups now through Facebook, and there's a great AARP caregivers group. So lots of places where you can get information and also just share. And then a number of disease specific groups. Lots of groups out there focusing on dementia. And then these resources, Senior Centers, Jewish for Good, can speak specifically about dementia. There's a number of Parkinson's related group and cancer related group. So I'm going to stop there. Here are the resources. That first one, long-term care information, that is a gift from our government. ACL is Administration of Community Living. I love this website. You can go and just, I gave a whole talk on long-term care, payment and understanding issues, and I got it all from this site. It is very user-friendly. You just start clicking on things and answering questions about what is long-term care, how can it be paid for. Let's really dive into Medicare. That's your taxpayer money at work. Enjoy it, use it. Jewish for Good Helping Department. I have their link. For those of you in Orange County, I have the Orange County Department on Aging, a range of resources and programs, from fitness programs to their aging transitions and OTs doing home assessments to support groups to education programs. Love it. I'm less familiar, but have spent a bunch of time on the Durham Center for Senior Life's website. Again, lots of support and activities and caregivers. If you want to dive into your home, AARP's Aging in Place Resources has really good safety guides. And then I did see a question about, well, what if we don't have people to help us through this? I'm not doing a push for myself. I'll just say that there is the Aging Life Care Association is the association for geriatric care managers. You can go to Aging Life Care and put in your zip code, and it will list a number of folks in the area that can work privately, including myself, but a number of people in the community that if you feel like you need one-on-one support and information, that's a great place to look. Okay, so I went a little bit, 10 minutes after I wanted to. So I really hope you heard me. Now I'm going to look at the chat more so I can see questions. I just say, will a recording of this presentation be available? Yes, you also will have access to slides. My email address, sorry, watch your eyes, watch your eyes. Okay, my address is heather@harmonyadvisorsnc.com. If that's too annoying, I have a super easy email address, which is heather@unc.edu. Through my faculty appointment with UNC, I got it. I saw my colleague Holly Ray joined. I do have some gratitude to, I have some nationwide colleagues, Amy Hladick in Colorado and Holly Ray in Pennsylvania, and they've become good friends, and we're all care managers, and we're all doing different talks, and so we decided to create a joint bit of information to share and learn from each other. But that also means if you have loved ones in Pennsylvania, if you have loved ones in Colorado, I actually use Amy for my family in Colorado, so some great folks. All right, other questions, and you can, oh wait, here we go. How to evaluate the medical care resources of a living place, daycare and activities. How do you tell how well they will manage you when you need higher levels of, okay, outside the facility? Okay. So let me make this bigger. So, oh, that made it too big. Okay, now it went away. So there's a few ways to evaluate the medical care resources. One is there is the, what is it? Medicare compare.gov. There are, for those places that are skilled nursing, here, I'm trying to open it back up. They do have a rating system, both for assisted living and Medicare, and you can go online. A lot of these places, I think it's the Medicare Compare website. And if someone knows it better, you can put it on there. But so that's one way. The other way is to, talk to the social workers at the hospital. The discharge planners aren't really supposed to say something about comparing, but you could always ask the key question, where would you have your mother go? Where would you have your father go? I was taught years ago, that's the sort of like key question of, where, other way is medical care is harder. And so you also look at who they're contracted with. Are they UNC physicians? Are they Duke physicians? Are they in-house? How much, you can ask questions, how much medical, when will you actually see your doctor? How many nurses are on staff when you're there? Are nurses, is there one nurse for 50 people? Is there one nurse, what's their ratio of nurses when we meet? I will tell you, it's very complicated right now. I've talked with a few of you on this call, and I said, there's a really good chance you're going to go into a place right now, especially skilled nursing, and have a really hard time. Staffing issues are shorter. People are not getting the level of attention, unfortunately, that they really should. So we are in a bit of a crisis. So I think having expectations, being there, I hate to say it, but being there a lot. You are your own and you are your loved one's advocates. So being aware of what the care plan is, what's the medication schedule, and making sure they got it. What's the, so what are the appointments that they're supposed to have, and are they getting it to it? So there are, 1 to 5 star places. So there is a way of asking how many stars they have, but it gets a little complicated. And as they often say, visit at all kinds of times of the day. You might not get the tour from the admissions people, but go and take a look at different times. What's it like on the weekend? What's it like in the evening? What is the category again of 55 plus living spaces? Well, that's independent living. And those can be called active aging communities, 55 plus. We have Overture. Usually they just say it. There's the other one. There's a few of them here, sorry. And they'll just, it's just that's just independent living. And now, if you want additional health support, that, that's independent living, and you can bring in home care, the new one on Estes. But a number of independent living, you can just bring in your own home care. And some of them finding out if they contract with the home care provider, so that way they already can link in with someone. Hope that answers. Link to read. Other questions? Jenny, am I missing any other ones? Actually, if you want, we can go back. Should we go back to full screen?
I think Tom Wolf has his hand raised.
Hi, Tom.
Hi, good to see you. Excellent.
Good to see you.
I recommend that it was a great overview. I recommend that you teach something like an Ollie class where you can really go into, I think, some depth on each of the topics. And I think there would be tremendous interest, because I know there have been previous courses on CCRCs. So I don't know if you would be interested in doing that or not, but you'd be great. Another thing I just wanted to recommend to people, there's a book that just came out called The Good Life. It's an ongoing 80-year longitudinal study, mainly through Harvard. It sort of highlights, Heather, what you were emphasizing, the importance of connectedness and your social support overall. So, and it's do any of you raise your hand if any of you seen that at all? I think it's just excellent, and it's well referenced, and it supports a lot of what you were talking about this morning.
Well, thank you, Tom. And clearly I know how to get involved with Ollie, thanks to you and yours. But yeah, and that's what I warned. This really was a whole bunch of the poo-poo platter, charcuterie platter, just touching on a bunch of things, because you each have different things that are important to you. I know that from some of the questions, and I just know that. And so, but I did, I'm glad you talked about staying connected, and because like, I'm so joyful and positive that it's weird to end on like, how are you going to pay for it? And then, here's some caregiving complexities. But I think start to really think about what gives you joy, how, even if your body start to change or your mind start to change, what are the things? Like, I've already made clear to my daughters, they know my favorite radio stations. They know the radio stations that get me up and dance and make me happy. What are the types of ways you want to spend your time? Do you love, do you want to spend all your time managing, your body and the forms, or do you want to be able to say, hey, I'm going to need a little assistance with my body because I want to be able to be social with my friends. I want to be able to do crafting. There's a lot of talk. There's a group of dancers that are organizing a new, ways to communicate together. So there's one of the things that I have seen is just tremendous joy and resilience among the thousands of older adults I've been with in the last 20 years. And now that I'm entering that myself. And so it doesn't all have to be like my knee just started hurting yesterday. So somehow I'm 52 and now the knee's kicking in. But I don't want that to be my whole existence. I want to still be joyful. I want to be able to be giving, like my dad talks on Zoom. I'm such an extrovert. I want to be connecting. So how do we manage this knee situation or other things so that way I can stay engaged? And I know for so many of you, whether it's smaller engagement or larger, we need a way. And I think if Rachel Bierman, are you still on? I saw Rachel's name. I'm going to give a plug for one of the amazing ways, if she's still on, is Rachel's the executive director of the Chapel Hill Carbaryl Meals on Wheels. What an amazing way to volunteer, to get involved. And I mean, if you're in your home, you can do phone calls, whether you like driving, you can driving, whether you want to sort food. But that gives people so much joy in order, literally, you are feeding and nourishing others while you're nourishing yourself. And then I'm looking at Jordana and I'm looking at Jenny Schwartz, and I'm sure there are tremendous opportunities in Stacy to volunteer at Jewish for Good. So there's participating, and then there's really contributing. And I think that, so get your documents out of the way, make sure you have them, and then enjoy living. Any other kind of questions or thoughts or favorite poo-poo platter items? Oh, great. Rachel said, I'm here for the plug. Yes, Cheryl. You can come off mute.
Talk about the pros and cons of moving where children live when you're aging versus staying in the community that you know. This thing really moved me when you talked about caregivers coming to see you when you're in the place and checking on you and showing the staff that they're very engaged. And it seems to me that they could, your kids could live their life maybe better if you went to them.
I think it's a wonderful question, and it's a wonderful conversation to have with your family. And I think for some, I mean, look, I'm a great example. My parents came down here to Chapel Hill. I think for some families that would be wonderful. It would be a wonderful gift to your children, potentially to come closer, or not. So, I mean, you could talk to your children and they might say, Mom, that's great, but we might get transferred. And so now you're going to be, so I think there's some nuances to it. I think so really talking about it as a family, do your children plan to stay in the same place? And if so, are there good communities to go there? And then going there, and if you do that, becoming engaged independently yourself, so that way the kids aren't taking over both your whole social life as well as your physical life. I think it can be a really lovely thing. Also, if you have grandkids, that you can live closer to them. So I'm a fan if it works. And but each family is incredibly unique. And also, where are there good communities? So do they live in an area where they have great communities, or are there better here? So I often talk a lot when the answer is I don't know. But that's a wonderful, wonderful, wonderful conversation to have. And to all of you, to have these conversations now when there's not a crisis in place. Use me. I'm your discussion trigger. You're like, oh my gosh, this woman was just going on and on about planning. What would we do? I mean, whatever it takes to talk with your families. And I'm sure you'll talk about that tomorrow with difficult conversations. Any way to open up. In my family, unfortunately, was after people passed away. And then it was like, oh, well, what would we have done in that situation? Or and that became, in policy, we talk about the window of opportunity. Even let this talk be the window of opportunity to ask their children. And it might be that your children want to move closer to you. I mean, look how cool this area is. So great question. And I did want to say there was a question before. Some of you have children, at least one of you shared that you have children with disabilities. And so when you're talking with I do really encourage you to talk to attorneys there and your financial advisors. There are things called special needs trusts, way to plan your estate as well as their estate if you want to pass on funds, and especially in a way that won't impede them later on from getting other special Medicaid programs for individuals with disabilities. So I did know someone had a question about how to plan for adult children with disabilities. And it's a wonderful thing to talk about, and talk about it with the professionals, because there are ways to protect your assets and their assets. Anything? Well, the caffeine's kicked in. I'm just getting started now. And have I made you all hungry for lunch? Yes, Cheryl.
Well, I'm only asking another question because no one else raised their hand, but the other issue is the timing of a move. That's a corollary. So I actually looked at Silver Spring, Maryland, where my daughter lives, and they do have facilities where you could move in at the time you need assisted living,
Sure.
unlike the ones here where you really have to progress. And how would
Yeah.
that?
I'm so glad you asked that. So I can I have all these like conversations or sayings, and I haven't had a chance to say this one, which is, there's a saying that we used to hear where you can't move too early, but you can move too late. And so this is part of it, is that soul searching. Do you want to move when you are healthy, vibrant enough, or aware to create a new community where you move? Or do you want to move in a crisis or when there's a healthcare situation? Then if you're going to move, that new place you're moving, what do you want it to meet for you? Do you want it to just meet your healthcare needs, or do you want to really join a community? And I think that's where that soul searching comes in. I've talked to plenty of people, not as much, but I do talk to plenty of people, and they make it very clear, I plan to move in a crisis. I don't want to move till I have to. And I realize that's going to be a crisis. And it's like, okay, I'm a big fan of informed choice, at least, and then I talk to families, your loved one has made it clear. But a lot of other folks really want to join a community to join a community. You can't go too soon if the sense is, maybe, but if the sense is learn routine, make friends, get engaged, have a sense of identity there before other need, if you have the ability, before other needs kick in. So that's what I encourage people to really think about. If there's going to be a move, and for many of us, there will be, even if it's short term, to rehab, what is the environment you want to move to and in what way? And for those, the longer you don't move, the benefit is you have more time in your home if you want that. But the downside is when you move to that new place, it's going to be maybe a more clinical or healthcare, and you may not be able to get as embedded. And this becomes big with issues like continuing care retirement communities, independent living communities, even assisted living. I'm a huge extrovert. I'm really social, but also I just believe in creating routines, especially as we start to think about brain changes, start to create those brain pathways and a sense of routine and home in your new home as opposed to your. So if the answer is, when should I move? It's, I'm biased because I'm a big fan. If you don't think your home can support you, then go ahead. And moving, here's the other weird thing. Moving will only get harder. It's a pain to pack up boxes. Now, you could wait so long that somebody else is doing it for you, which is sort of brilliant. And I've talked to people, and if that's your plan, that's great. But if you plan to the move, our knees are only going to get worse. The boxes are only going to get heavier. So it just depends on how much you want to control versus, and plenty of people, are like, I'll deal with it, or I'll have others. So there's no right way. It's just understanding the implications, the consequences of our decisions. And with that,
Thank
I know
you.
it's 12 o'clock. Jenny, do you need to cut me off? If not, I can stay.
I want to be respectful of your time, and I know that there's some people who have questions. If you have a few more minutes to answer a couple more questions, I think that'd be great. Maybe we can just do a few more questions or a couple more questions.
Sure. Happy to stay on. Good question about, does Uber have accessible vans to accommodate a wheelchair? That's not that I know of now, but I've heard some talk in development about this is a big business model, or something like a $3 trillion industry, the over 50 needs. And so I think you're going to see a lot of these options start to kick in. Right now, no. That would be harder to set up, but there are a lot of transportation companies, private transportation companies in the Orange and Durham where you can start to request that, as well as the public transit. And I have a client that takes public transit every day to Adult Day. So again, some of these things can be really expensive. And so maximize your taxpayer dollars. If you're living in Orange County and you're living in Durham County and there's transportation that's provided through public, and you can get the Easy Rider and these specials, really, it's great to know about these resources. I don't I'm going to take a quick peek if people want to raise their hand or come off mute.
And in terms of the resource link, Heather has nicely given us the resources that she mentioned, many of them ahead of time. So I think I put a link, I'll do it again, put a link to the website here that should have the links to the resources that you had in your talk. And also we'll be sending out the PowerPoint, which will have that too.
Mm-hmm.
Any other?
All right. Well, thank you. I'm sorry the voice got in and out. I pride myself on talking loud and clear, so it pains me that you couldn't hear all of it, but you have the information, and I'm really best of luck. I know many of you, and those I don't, you are now my new best friends, and I look forward to seeing you at Jewish for Goods events.
Heather, thank you so much for sharing your expertise. And this is such an important topic. And I know that I'm taking a lot away, and I'm sure everyone else is as well. So thank you again. And you are all welcome to the resources that we mentioned. I'll put that link in the chat, and also it's on the website. And we just appreciate you taking the time and sharing with us, and we appreciate you all being here. Tomorrow, the conference continues until Thursday. Tomorrow's topic is planning for difficult conversations, so we hope to see you there. And Heather, thank you so much for reminding us of what's coming up and these important things. So thank you all. We hope you all have a good day. I will be sending you all out, just so you know, next week, at the beginning of the week, a feedback form about this, and we really, really hope that you will take the time to fill it out so we can continue doing what we're doing well and make improvements if we need to. And also just to hopefully see you at other of these events, and also some of our other programs, such as I mentioned the Schmoozenosh program, which is April 26th. Also on April 26th is going to be our Nasher, a virtual tour of the Nasher Museum. So we hope that you are national art exhibit at the Nasher. I'm sure Jordana could speak to it better, but no, we're running out of time. So just wanted to thank you all for being here, and we hope to see you at future programs. And again, Heather, thank you so much for your time and your expertise.
Thank
Have a good day, everyone.
I always stay on.